Let's talk about some of the specific diagnosis and locations of cancer and how we might approach them. One of the most common sites of carcinoma is the tongue. It depends upon whether it involves the front part of the tongue or the back part of the tongue. The front part of the tongue is typically treated with surgery and perhaps radiation and chemotherapy. The back part of the tongue is often treated with radiation and chemotherapy, and in some cases, transoral robotic surgical resection of the tumor itself. Oftentimes, neck operations are accomplished as well, where any lymph nodes that might be involved with the tumor as it spreads into the neck area are removed as well. Oftentimes, with larger tumors, we combine surgery with radiation and chemotherapy. Again, the goal is to minimize the amount of radiation or chemotherapy needed, and at the same time, make the surgery of such a degree that it doesn't produce major problems with form and function, so that what we take out can be replaced so that you can still use the tongue or the swallowing mechanism effectively after treatment. Prognosis in most of these tumors are good, and in our series, well over 70 to 80% of patients with oropharyngeal cancers are cured. Another common cancer is cancer of the larynx, and this commonly presents with simple symptoms such as hoarseness. Again, depending upon when you see your physician and when it's evaluated, it depends on the stage or the size of the tumor. Smaller tumors can be treated with simple transoral laser excision or partial laryngectomy or minimally invasive surgical procedures. In some cases, radiation therapy is given. In some cases, radiation and chemotherapy are combined in a so-called organ preservation technique where even larger tumors can be treated while surgery is saved for those cases where response is not present. The majority of these patients are also cured. So again, cancer of the tongue, cancer of the tonsil, the oral cavity, cancer of the larynx, all are treated with a variety of techniques, including surgery, radiation, and chemotherapy, with really outstanding results. And so the diagnosis, as fearful as it is, doesn't necessarily mean a death sentence. Most patients are cured.